This is John McPhee for the SaltWire Network. I'm speaking to Dalhousie microbiologist Dr. Chris Richardson about a study he conducted that looked into the effectiveness of combining two different vaccines. Dr. Richardson, let's start with how you looked into this question. How did you conduct your study?
Okay, John, this is just basically a pilot study, and it's kind of a study showing that you can actually use a combination of the AstraZeneca and the Pfizer vaccines in sequence. This is something that hasn't been done, and it's only a small study, but it's a prelude to larger ones that are ongoing. That Joanne Langley is actually doing a large-scale study with about 23 people who are recruited. But we used actually two, I wouldn't say elderly, but because I'm pretty close to that age, two 66-year-old enrollees, and it was male and female, and actually they were actually inoculated with the AstraZeneca. Then 33 days later, they were inoculated with the Pfizer vaccine. And we tested for antibodies at 25 days, and that was into the study after the first vaccination, and we tested for antibodies at 46 days. That's right at the end of the study. And we were really, really surprised at the way the Pfizer boosted immunity from the primary vaccination. And it was a short amount of time, and it was at a time where we compared it with a convalescent individual, a person who had survived COVID-19 and had a known to have a very good antibody response. And it was almost exactly the same antibody response. So it's very effective. So this is a heterologous vaccination program. And we did not compare Pfizer and Pfizer vaccines. That's the one that's homogeneous, basically. And that could be down the lane a bit, but all these other studies are coming along. And so it's just mainly to show you and reassure you that these heterologous vaccines with the AstraZeneca and Pfizer are going to work.
Okay, so in terms of the results of your study, what kind of direction it would give to somebody like me, for instance? I got the first dose of the AstraZeneca vaccine, and the province is giving me the choice for my second dose of any vaccine that I want. So in terms of your study putting me in one direction or another, can you kind of make that conclusion that I should get Pfizer? I mean, that if you took a quick look at your study, you'd say, oh, I should get Pfizer if I got AstraZeneca for the first dose.
I don't think it's going to really matter too much in the long run, but I'm an advocate of Pfizer and Moderna because they're new kids on the block and very high tech. But the AstraZeneca, I would kind of say, is like the Volkswagen, and the Pfizer and the Moderna are kind of like the Mercedes and the BMW. But they're both going to get you to the party probably on time. But the style is just a little bit different. That's all. Yeah.
Okay. So in terms of that, the answer to that question, then any vaccine for my second dose is basically going to give me around the same protection in terms of the effectiveness rate. It's going to do the job.
Yeah, and then there's always the concern about blood clots, and that's for the second vaccine is supposedly very, very remote.
Right.
But I think for the primary, they're saying it's about 1 in 100,000, which isn't too common. It's quite rare, but still, it's not perfect. So, but and especially for men, I think they said it was more prevalent in women. The problem with blood clots, but I would prefer the Pfizer and the Moderna myself. I've been inoculated with the Pfizer, and I had some slight side effects. That was a little bit of an achy arm, and had fatigue and a little bit of a fever overnight, and that was about it. A headache, but that's very common. And then again, for the two patients in this study, they had the same symptoms for their secondary inoculation with Pfizer. So just minor side effects.
Okay. The fact, just final question, just the fact that there's only two subjects involved in this study, oftentimes vaccine trials as such. I realize this is not a trial, this is a kind of a limited study, but the fact that only two people were involved, I mean, does it kind of introduce some caution in terms of the conclusions that you drew?
Yeah, I would say you can't quantitate it as much, but I think it's a kind of like a black and white issue or a plus minus sort of effect. I'm a basic scientist, and I like to see a lot of just results that are concrete and that I know. I'm not always interested in statistics. I make these reagents. The reagent I used actually was what I really wanted to test. And this is a model virus, which is very safe. And I injected or incorporated the spike protein of COVID-19 virus into this model virus. And it also has a gene, which is the gene for fluorescent protein from jellyfish. So you can actually visualize the effect, whether it's being neutralized by antibodies or not. And I had a very nice figure in my paper showing that if you have these neutralizing antibodies, which are raised after the Pfizer vaccination, that it blocks the production of the green fluorescence, and therefore the model virus is inhibited by these neutralizing antibodies. So this is what I wanted to test. And I made a lot of different reagents over this last year in the lab. I wanted to feel useful. So I made lots of spike protein and this model virus. And I made a couple of vaccines, which are also in this model virus platform, which I sent to Saskatoon. And they're kind of being tested in ferrets and hamsters, and they could also work.
You see. Okay. Interesting stuff. Thanks a lot for your time. We appreciate it.
Okay, you're very welcome.